Hey everyone, how's it going? I hope you're doing well out there. So today, as I was wrapping up at the hospital, the FDA actually made an announcement about which groups can get the COVID-19 booster vaccine from Pfizer. So in this video, I just wanted to summarize what they said, who is eligible to get it, and also help you get prepared for this winter in case you are interested in getting a booster dose. If you're new to the channel, welcome to TraumacistRx. My name is Freddie and I'm a critical care pharmacist. And on this channel, my goal is to make healthcare information easier for you to understand so you can make more informed decisions. If you're returning to the channel, welcome back. Thank you for supporting the channel. Make sure to always smash the like button and subscribe button below, and also the notification bell so you can get notified when my next video is uploaded. Also make sure to check out the description for ways to learn more information and also support the channel further. Now let's get into the video. So in order to get the third booster dose, you need to meet some criteria. So the first criteria is to wait at least 6 months after completing the 2-dose series of the Pfizer vaccine. If you are wondering, the booster dose is the exact same dose as the first and second dose. In other words, it comes from the same vial and is no different. So after waiting 6 months, the next thing you need to do is meet one of the following 3 criteria. The first criteria is you have to be 65 years or older, and that really reflects what we're seeing in the hospital, where we're seeing more elderly people who are fully vaccinated actually coming in as breakthrough infections. The second criteria could be being 18 to 64 years old and also being at a high risk for developing severe COVID infection. So in this group of people, the main people they're targeting is those who are immunocompromised, those who may have had a history of organ transplant such as lung, kidney, or heart, or even liver, and those who might have an immunosuppressive medication or chemotherapy that they're taking. Because in this group, all of these patients may have had a decreased response to the initial first 2 doses of the vaccine, so giving this population a booster dose will just give their immune system a boost and allow their immune system to fully adapt and get as much protection as possible from the vaccine. And the third criteria that you could potentially meet is being 18 to 64-year-olds and also working in an occupation where you're more exposed to COVID-19. So this group encapsulates people who are either healthcare workers, first responders, those who are teachers or educational workers, those who work in prisons, daycares, grocery stores, and occupations that are similar to these. So if you did meet any of those 3 criteria and also waited 6 months since your second dose, congratulations, you are now eligible to get a booster dose if you'd like it. So as far as symptoms and things to expect after the 3rd dose, based on the Pfizer data, they looked at 300 people, and of those 300 people, the most common side effects they found were the same common side effects from the 2nd dose. So if you remember, some of the common side effects, if you did get your 2nd dose, were fever, chills, fatigue, muscle soreness, joint pain, swollen lymph nodes possibly, and just feeling a little yucky for a few days. From my personal experience, my 2nd dose hit me pretty hard, but it only lasted about 16 hours on the 2nd day. So I expect these symptoms to be the same, and according to the data, you shouldn't really expect anything different. So if you are afraid because of symptoms to get a booster dose, that's what you should expect. So again, my expectations from the ACIP are that they'll refine all of these things, and maybe with more data that comes out this week, they're going to add more criteria and also more expectations with a 3rd booster dose. So I'm pretty curious to see what the ACIP will say by the end of this week or next week, and I'll update you accordingly. But yeah, so as far as my thoughts, I think the FDA did a really good job initially in looking at the data, even though it's a little bit limited, and matching that with what we already know about the COVID-19 Delta variant surge that we've experienced the last couple months. And based on all of our knowledge, booster doses really seem appropriate in this specific population. For instance, based on the data, we know that these booster doses are safe and effective, and we also know that giving a booster dose isn't going to hurt the patient, but it will basically increase our antibody shield so that we are all protected for a winter surge, at least those who are eligible to get it right now. We also know, and what we've seen with the Delta variant, is that those that are fully vaccinated, elderly, or immunocompromised are at higher risk of a breakthrough infection, which is something that I've seen a little bit throughout the summer, in addition to my 99% unvaccinated patients. But giving this vulnerable population a booster dose will not only help keep them out of the hospital, but keep them protected and lower their risk of getting a severe infection or even spreading COVID-19. And we also know, because Delta variant is so spreadable and contagious and can produce up to 1,000 times more virus in the air, protecting our frontline workers and those who are highly exposed to COVID-19 is really important, so that way this group of people doesn't experience any severe infection or breakthrough infection as they work through the fall and winter where we expect a potential surge. So lastly, I also wanted to emphasize that even though this booster news is very good, it doesn't change the fact that the only way to get out of the pandemic is through immunity. So whether you've been previously infected and get 1 or 2 doses of mRNA vaccine, or getting a full series of the vaccine without being infected, the only way to get through this pandemic is through getting immunity, and the best way to do that is through vaccines. Again, America right now the US is at 54% fully vaccinated, so we have a ways to go. And hopefully, as more people get vaccinated, we can boost our protection from 0% if you're unvaccinated to 80% at least before this fall and winter, and hopefully try to avoid the surge we had earlier in 2021. So if you watched to the end, thank you for watching. Thank you for supporting the channel. Make sure to hit the like button, subscribe below. I hope you learned something, and I'll see you in the next video. Take care.